others. And let me turn it over to my colleague, Melanie.
Hi, everyone. My name is Melanie Richter, and I'm the Senior Director of Development at Project Home. I'm a native Philadelphian and a member of Project Home staff for 3 years now. I assist with fundraising from corporate, foundation, and government sources, and also manage our team's data operations. Today, I'll act as your moderator for the Q&A at the end of our presentation, along with Samantha, who will introduce herself next.
Thank you, Melanie. I'm glad to be here tonight. My name is Samantha Blatt. I'm the Special Events Coordinator at Project Home. I plan our grand openings, groundbreaking, special fundraisers, and anything that comes along the way. I'm pleased to be here acting as a moderator for my first at home. Joining us tonight is our colleague, Robert Smith, and Robert will speak a little bit more now.
Hey folks, so glad to have some familiar faces and some new ones at our at-home series tonight. We're really grateful that everyone's here to learn more through the very expert and beautiful lenses of Monica and Ivel and Linda. And it's my great pleasure to hand it off to have a brief introduction from Monica Medina-McCurdy.
Hi, everyone. Thrilled to be here with everyone this evening. My name is Monica Medina-McCurdy. I'm a physician assistant, and I'm also the Vice President of Healthcare Services. And I've been with Project Home in total about 17 years, and delighted to be here with you today. I'll hand it over to Ivel, Dr. Morales.
Hello, everybody. My name is Ivel Morales, and I am a family medicine physician, and I'm the medical director for the Home of Hope. And I'm really thrilled to be with you tonight. And I'll pass it on to Linda.
Just need to unmute Linda, I think. I think you're still muted, Linda. There you go.
Do I need to say it again?
Yes, thank you. Sorry about that.
Okay, my name is Linda Costello. I was currently homeless. I am no longer am. Thank you for inviting me, and thank you for letting me participate.
So glad you're here. So glad
Thank you.
everyone is here. Thank you, Linda. You'll hear more from everyone in a little bit. In the meantime, Robert, you want to introduce a special activity question for us?
Thank you so much, Annette, and thank you to all of our expert and distinguished panelists, and for all of our guests who are here for At Home, especially across the last 15 months. We've all been focused more on our mental health and our physical wellness as well. So please drop it in the chat and let us know during these trying times, during these difficult moments, how are you prioritizing your mental and physical wellness? And my colleagues, Sam and Melanie, will read some of those responses as they come through.
Exercise, awesome. Yeah, Amy, I've been trying to keep up with that as well, doing some mental yoga myself. Taking breaks from work throughout the day, yes.
There's been some acknowledgement that it's been tough to prioritize them these days.
Learning to play a new musical instrument, that's great for your mental well-being. I wish I had the discipline to do so.
Walking and hikes in nature, certainly easier these days now that it's gotten a lot warmer.
Matt B says podcasting, exercising at the gym, and also going to see a therapist, very important, especially over the past year.
Something very exciting, gathering with friends so safely.
It'll be nice to gather in large groups of friends soon.
Well, we really appreciate everybody sharing those very personal reflections. And again, it's really my great pleasure and honor to hand it off to Annette Jeffrey to get us started.
Thank you so much, Robert. Thank you, everyone. This is good for my mental health and physical health to feel connected. And so really glad for this opportunity to share together in this work that you all help to support and champion in our city. So thank you so much. As you know, because you're here and because you're part of this work, homelessness is solvable. One of the things Sister Barry will say often is that it's the most important thing you can know is that homelessness is solvable and it takes all of us. So the part that we each play is contributing to the end of homelessness in Philadelphia. And that's what we want to see. That's our dream. We have the model of HOME that really started at the very, very beginning when Sister Mary Scullion and Joan Dawson, now Joan Dawson McConnon, started in the recreation center in the locker room of the Marian Anderson Rec Center. This model, HOME, really formed and has been the basis of our work ever since to address the root causes of homelessness. H, housing, including our outreach and permanent supportive housing. O, opportunities for employment. M, medical care. And E, education. K through 12, college access and adult education being the key factor for preventing chronic street homelessness from taking root. So as we know, M is such a key part. And so tonight we really want to talk about the M in home. And we're so excited to have my superhero during this time and always, who has been leading not only so much of our community, but our staff as well in safety, health, and wellness during the pandemic, Monica Medina-McCurdy.
Thanks, Annette. That was very kind of you. And there's a million heroes here at Project Home, people who do inspiring things every day to keep hope alive in really trying times. So yeah, just thrilled again to be here, and thanks for that introduction. Yeah, the M in home, it was really beautiful that they put the M in home before they actually had services that can be considered M. So the M really kind of got its start about 3 years in. But again, like so beautiful that they said, well, you know, we are about home and we're going to put the M in there and, you know, eventually it will come, and they had faith and it did. But the M, and I'm going to share with you a timeline over the next couple of slides that hopefully will, you know, kind of give you a good idea of the breadth, like really the history and the journey that we've been on in terms of our healthcare services. So huge kudos out to Jefferson Hospital, because really without their help, and specifically before the hospital, Big H, it really started with a couple of people at Jefferson who were highly committed. A medical student, Dr. Laura Weinstein, who is now an attending physician and is still a staff physician with Project Home as well as with Jefferson. As a student, she helped initiate services at Project Home with the help of other volunteer students and her faculty mentor back then, who was Dr. Jim Plum. And through their impetus of getting services started in St. Columba Safe Haven back in the day, and then at St. Elizabeth's Community Center later on, Project Home then also hired our first nurse to work with them. And for the first few years, really from like through the 90s into the early 2000s, our M was kind of a small M, but an M nonetheless, providing a free healthcare clinic to folks experiencing homelessness and to some folks in the immediate neighborhood surrounding St. Elizabeth's. St. Elizabeth's was the original home and has now been renamed Helen Brown Community Center in the last couple of years. And then fast forward to like the 2000s, and along comes Stephen Klein, who because of his own interest in health and wellness and his also being inspired by the mission, he gave us some seed funding to help us enact our larger vision for healthcare at Project Home. And with that, we were able to create some more infrastructure in the form of a vice president position. And then we were able to put in, along with real estate development, put in all of the hard work of getting a project together to start the Stephen Klein Wellness Center, which is now at the corner of 22nd and Cecil B. Moore, and which is the main health center site. And And then at Stephen Klein, what we've done there since we opened up there officially at the end of 2014, beginning of 2015, is we kept our primary care services going, integrated with behavioral health. We opened up a dental practice. We also opened up a satellite clinic. It's not shown on here, but we did open up a satellite clinic at our sister agency, like colleagues of ours at Pathways to Housing PA, which that agency serves chronically homeless individuals in Philadelphia. So we were able to open up a satellite primary care clinic at around the same time that we opened up Stephen Klein. We opened up a pharmacy, and then we started medication-assisted treatment, especially when the opioid epidemic really hit Philadelphia, and in particular the homeless population. And the Hub of Hope, and of course you'll hear a lot more about the Hub from my colleague Ivel, about the Hub and our ability to open up an integrated primary care clinic and behavioral health clinic that now also offers dental. And then we added more robust wellness services, nutrition services, addressing social determinants of health. So hiring community health workers who will work with our patients to address all those things that a doctor, a nurse can't necessarily address that affect health. So things like food insecurity, helping with transportation, all of those things that are super important to people's health and well-being. And then, of course, the pandemic hit last March, and we were able to, if you want to advance it to the next slide, when the pandemic hit in March 2020, we were kind of really forced into coming up with a new way to deliver healthcare to people that everybody else in the world had to do. And so we did a lot of telehealth, where about 50% of our patient contact moved from in-person to talking to folks over the phone and sometimes over video conference. And I want to mention here too, and Ivel will talk more about this, is that the Hub of Hope, given that its mission was to serve folks living on the street and folks that are unhoused in Center City, Philadelphia, they were critical, absolutely critical to the response, the COVID response amongst the homeless population in Philadelphia. So we're not just talking Project Home, but they really have had citywide impact because of their presence and their mission. And it really, without the Hub being there, I think a lot of very critical services wouldn't have been able to be provided to folks living on the street during the pandemic. Huge challenges. Ivel will talk about that, but it was really inspiring to see the Hub of Hope team pull together in the middle of a pandemic and deliver critical services. Also in the middle of the pandemic is the healthcare team was stretched to also work on a new project in the summer, which is to provide protective housing for individuals living at Project Home. So literally some of our healthcare workforce had to get redeployed to this new project because their original positions weren't needed as much. Their hours had to be cut because of the pandemic. But instead of having to cut their hours or lay people off or furlough folks, we were able to redeploy part of our staff to this protective housing project over the summer. And that particularly helped folks who are living in our congregate sites, like Women of Change, St. Columba, Kairos House 1515, Sacred Heart, St. Ne's Recovery Residence. Individuals 60 years of age or older who had underlying chronic health conditions, who we offered them to stay in a hotel for several weeks between July and September, so that they could get out of that congregate living situation where they could fully social distance and protect themselves from the virus in their own sort of living unit with their own bathroom. And the staff there worked with them 24 hours a day and helped bring in meals 3 times a day and provided some social interaction. So that was a really beautiful project to get involved in over the summer. And then we also began to, through like everybody else, kind of just continuing to wait for a vaccine to come out. We continued all of our work on testing and trying to mitigate our community's risk from getting sick from the virus. And in January, when the Moderna vaccine was made available, we started our vaccine clinics at Stephen Klein Wellness Center and the Hub of Hope. And since January 8th, when we gave our first vaccines, we've given about 2,400 doses, and about 1,600 unique individuals have been vaccinated. So really excited that, and we were able to find additional staff capacity. So even though the vaccines were there, we didn't automatically have the staff to run these clinics. But really through some volunteer nurses and some retired nurses that we were able to locate fairly quickly, we were able to get those clinics up and running. So that's the sort of overview. And now I'm really excited to introduce Dr. Morales, who'll talk more about the Hub of Hope.
Hi again, everybody. Can you hear me okay? Yep, okay. So I am really excited to talk to you a little bit more about the work that we do at the Hub of Hope, and a lot about the lessons that we've learned by working with the homeless population there. The Hub of Hope is a homeless engagement center that is located in the subway concourse, right underneath City Hall. We are a place to provide shelter during the day for those people that are experiencing homelessness, and a place for people to get out of the elements, out of the weather, do simple things like watch TV or get a cup of coffee, or do more involved things like showers or laundries, or and also we have case management and healthcare services there. Next slide. In our clinic, we have a variety of services. We we do a lot of acute care. So a lot of the things that people come in with, colds, or if they're acutely sick, they have a laceration, we can do sutures, anything that like an urgent care would do, then we are there to do. But most exciting, we are the primary care providers for a lot of these patients. We do a lot of chronic disease management, and that means, taking care of people's diabetes, high blood pressure, chronic obstructive pulmonary disease, and some of these more involved diseases. Also, we are all primary family practice practitioners, so we are all really big into preventions and do a lot of work on family planning, vaccinations, smoking cessation, a lot of substance use disorder treatment, and also addressing mental health. Our team is composed of rotating providers. We have a full-time behavioral health consultant. We have a medical assistant, an administrator, a part-time nurse, and also we have a part-time psychiatrist that is able to provide consultations for us. We also have a dental room, which unfortunately is on hold right now with COVID, but we're hopefully soon restarting dental services. So a couple of times a week we used to have a dentist and a dental hygienist that rotates there as well. Then, with the pandemic, on top of all the things that we were doing, we had to respond, like Monica mentioned, to the great need that was COVID. As you can imagine, a lot of our patients at the Hub were at higher risk for acquiring COVID because most of them live in congregate settings, either shelters or just congregated in the street or recovery houses, and so they were higher risk, or are at higher risk for getting COVID. So we, since the very beginning, started a testing site right outside the Hub, and is that picture to your right, that's our testing site. And we've been doing nonstop testing for people that have COVID symptoms, or for those individuals that need a negative test to get into a shelter. And on top of that, we've had to work very, very closely with the health department to be able to place individuals that are COVID positive, or have been exposed to COVID, or awaiting a test result, in a safe space. So the city opened up a city and isolation, a quarantine and isolation site. And we work closely with them to be able to screen individuals and basically triage and refer people to them so that people can be safe and we can prevent further outbreaks in the shelter system and other congregate settings. And then additionally, we've also started vaccinated around in February, and we've done a good amount of vaccines, about 370 first doses, and these are mostly homeless patients. And we've been doing Moderna since the beginning, and our return rate has been surprisingly great, about 84% rate. So I think, what I've learned at the hub, and I think the most valuable lesson is that that I've learned since working there for the past three and a half years is that the cycle of homelessness is very, very complex, and the connectedness of homelessness and health is very, very tight. Next slide. So I think, there's many factors affecting homelessness. There are some personal factors, there are some systemic factors. What we see at the hub is that a lot of the time, homelessness starts with a change in someone's health status. For example, like if somebody gets a diagnosis of cancer, or if somebody gets injured, and then they start needing to take time out of work, and then they exhaust their sick leave time, then all of a sudden they become unemployed, and they can really no longer pay for rent, they lose their home, and then suddenly becoming ill is not just being ill, but it becomes a housing issue. And then in return, we have people that don't have a roof then have a very poor opportunity to heal. So if somebody, let's say, has an injured back, something that could sound so simple, right? But it works in construction, lose their job, then they have an injured back, and now they're sleeping in a cot in a shelter. They're just gonna get worse, and then it's just a cycle that is really, really hard to recover from. And all of that in a society that is not necessarily friendly and has so many systemic failures. So, I think, some of these systemic failures are the lack of affordable housing, our unfair justice system, and also the fact that a lot of our healthcare is actually inaccessible and expensive, and not our healthcare, I hope, but just like society in general. But yeah, so I think what I'm trying to say is that the causes of homelessness are very complex, and I think once people fall into homelessness, it's really, really hard to get back on your feet because the society is not providing good opportunities for folks. Next slide. Then the next thing is that I wanted to mention as well is that when people are homeless, they, a lot of their chronic medical conditions tend to get worse. So we see a lot of diabetics, for example, that by not having a home, they don't have a place to store their insulin, or they don't have opportunity to adhere to a diabetic diet because they are eating in a soup kitchen or in a shelter. So I think we see a lot of people that had some maybe minor condition, and then when they become homeless, it just gets worse and worse. So the bottom line is that a lot of our homeless patients really have very poor health, and by having poor health, it just becomes harder and harder to be in society. So we see that the average kind of mortality rate is a lot higher for homeless patients. So I think, my main message for all of you guys is that, Project Home mission is to end homelessness, and because we really understand the connectedness of health and housing, we've really made a commitment to address healthcare and to do it so in a comprehensive way, and we're trying to deliver top-notch medicine to our patients so that we can really serve to our mission of ending homelessness. And with that, I'm going to introduce one of my favorite people. This is Linda Costello. Linda is my patient at the Hub of Hope. And yeah, we met in 2018, and here we are. Hi, Linda.
Thank you so much for inviting me, and thank you so much for suggesting me for this. I keep talking. I became homeless, like Dr. Morales said, in 2018. I had a good job. I had a car. I had a home, which I lived with my sister for 10 years. My car got hit by no fault of mine. My job got downsized by no fault of mine. And when I lost my job and my money eventually ran out, I didn't have any money. So once the money ran out, my younger sister, with whom I lived with, asked me to leave. And I did what she asked. I didn't have to, but I did it out of respect for my sister. I didn't know where to go. I looked online and I looked up on shelters. And the first one I found was one in West Philly. I called them and I said, I need a bed. And they said, you can't have a bed. You got to go to Ocean. I said, what is an Ocean? They said, it's at 14th and Cherry. I said, oh, okay. You had to go to OSHA every day and sign in, have your bags searched every single time, which is demeaning and humiliating, like you were carrying something in there, which you weren't. And in my case, I've never had an alcohol problem. I've never had a drug problem. I just had bad personal luck. All the people that are homeless are individual and different. Each person has a different story. Now, last year, because of the pandemic, a lot of people have become homeless, and it's no fault of theirs. How I met Dr. Morales was from OSHA. They said to me, well, there's this place called the Hub of Hope. They told us where it was, and we went, and I went there. And I didn't even know what it was when I went there. When I went in, it was kind of different, but I found out there was medical services, and there was social services, and there was a living room with Sister Eileen, which was very great. I had anxiety problems before this all happened. And I knew that being in the situation that I was going to have more anxiety, not knowing where I'm going to be every night and where I have to live, and have to stand in line outside and make sure you get in and get safe. So that's where I met Dr. Morales. Well, the first week that I was at this shelter in West Philadelphia, you did not sleep in a bed, you slept in a chair. And about a week after being there, I woke up one morning and my left leg was totally swollen. I did not know what was wrong. It was saturated in fluid. One of the girls said to me, what's wrong with your leg? I says, I have no idea. So she said, do you want me to call an ambulance? I said, yeah, because I don't know what's going on. So I was taken to a hospital where they just said it was an infection. That was all. Well, I had been to Dr. Morales to get anxiety medication, and I went and showed her, and she looked very disturbed. She said to me, Linda, you need to be in hospital. She said, you need to be on intravenous antibiotics, and you need to go to a respite, because I had an open wound. That was in June of 2018. I was in the hospital for 5 days on 24/7 intravenous. Then after that, because I was at Hanneman, Hanneman paid for the respite. So I was at a respite for another 5 days. But after I was done at the respite, unfortunately, I had to go back to OSHA and go back to the same scenario that I was living in with that particular shelter in West Philly. Well, that was in June. I was placed in that particular shelter in August of 2018. By 2019 of March, I had 7 sinus infections. I had pneumonia twice. I had cellulitis 3 times, which they found out later on was MRSA. I thought to myself, if I don't get out of this particular shelter, I'm going to go out of this shelter in a body bag, and I didn't want that. So I went to the Hub of Hope and I met Robert Sims, who was the case manager at the time at Hub of Hope. And I told him that I heard about a place by the name of Sacred Heart, that I heard it was nice, the food was nice, they were polite, they were courteous, they didn't treat you like a piece of dirt in the ground. So I said to him, could you use it possibly, can you get me in there? Well, that was in March of 2019, right before Easter in that same year. I think it was April 18th. It was the day before Good Friday. He comes into the living room at the Hub of Hope, which I do the group with Sister Eileen, and he announced to everyone that I had gotten placed in Sacred Heart. You do not know how a giant relief that was lifted off of my shoulder. But in the meantime, I'd applied for Social Security at this particular respite, and I got denied. But I didn't know I got denied until January of 2019. So I had got a contact through HAP, which is the Homeless Advocacy Group, and I met a lawyer, and in February of 2019, they started working on my case. By Memorial Day of that same year, to May of 2019, I had finally got my Social Security disability. And they went back to 2016 to when I lost my job. And I was at Sacred Heart from April to end of September of 2019. Once I got my money, I could start looking for an apartment. So someone from the Hub of Hope, her name is Emily Hopkins, she recommended me to come to Kate's place. I started the paperwork in August of 2019. By the end of September of 2019, I finally got word that I got an apartment here. I was told I'd be a great fit for the community. That was in 2019. I have been living in my apartment since then, up until this day. I also go to, I get my medication from the pharmacy at Project Home. I have also had the vaccine at the clinic at the Hub of Hope, and I'm very grateful. And my health and having a home are really important to me, because one entwines with the other. Because if you're healthy, you're not going to feel like you're going to feel horrible. But I have realized since I've been at Kate's place, this is the first time in my life that I'm totally alone. And it doesn't bother me, because I answer to no one but me. Yes, I was independent living with my sister, but things were just different then than they are. Things are different now than they were then. And I am so grateful to have met the people at the Hub of Hope. I am so grateful to have met the people at Project Home. Project Home not only found me a home, they saved my life. Did I leave anything out? I try to get involved with the people here. Like, I try to get involved with the Residential Advisory Board and the Tenant Council. And I've also been in an article in 3 different newspapers. One was about the vaccine. One was about in Kensington newspaper about the vaccine. Another one was in Project Home winter newsletter. And also I was in an article in the very beginning of my homelessness journey. Someone at Suburban Station had got stabbed, a homeless person, and a person came in from the Inquirer to write an article about what happened. And we got spoken to individually, and I was in an article on that too. And I've also am doing, with Project Home, I am working on a video for the Bill of Rights. How many minutes I got? Thank you very much, and I appreciate your time, and everyone, I just appreciate you.
Thank you so much, Linda, and we appreciate you too. We are so grateful that we had this opportunity to hear your story, as well as to hear from Monica and Ivel tonight. Now, we'd like to take a moment to hear from everyone else. Please let us know if you have any questions about anything that we've shared today by typing your question into the Q&A section at the bottom of your screen. If you put a question into the chat box instead, please pop it into the Q&A section when you have a chance, so that we have the ability to answer it. And I will read the questions out and give it an opportunity for our panelists to answer. If you don't see the Q&A section at the bottom of your screen, simply move your cursor down towards the bottom and you'll see the selections appear. While we wait for some questions to come in, I just wanted to share some comments that are coming into the panelists from chat. One person says, Linda, thank you so much for sharing your story. Very inspiring. And thank you to all of the other presenters. I learned a lot tonight. Another person shares, Linda, thank you so much for sharing your personal experience. I'm a trustee of Project Home. It's inspiring to hear how Project Home, the Stephen Klein Wellness Center, and Dr. Morales have helped you, and others like you who have experienced homelessness along with serious medical issues. Another comment that came in is to thank you for sharing with us. Your inner strength is amazing, Linda.
Just gonna jump in here, Melanie. I see that there is a hand raised in the participant window. Marie, if you have a question, if you want to drop that in the chat or in the Q&A, we'll read that out loud. But I also wanted to take a minute to say thank you to RJ Sims, who is here supporting Linda off camera. RJ is the resident service coordinator at Kate's Place. He works with the residents as case manager and just provides general support. So thank you so much to RJ for being here tonight with us as well.
Thanks, Samantha. Our next question comes from Norma Reichland. Linda, thank you for sharing your story. We have a family member who is a pediatric nurse at CHOP. He would like to volunteer at Project Home. Do you need nurse volunteers? If so, who should we contact? I think that's a question for Monica.
Yeah, they can contact me, and I'm happy to I'll put my work number here in the chat for everybody. But yeah, that person can contact me directly, and it's really beautiful timing. We do already have a pediatric CHOP nurse and ICU nurse volunteering with us in the vaccine clinic, and with the pediatric vaccines coming online, at least the 12 to 15-year-old vaccine coming out hopefully in the next couple of weeks. We're trying to get organized for that and to be able to offer the vaccine at Stephen Klein. We're not exactly sure how we're organizing it yet. Literally just had a conversation about it today. But yeah, please direct them my way, and I would love to talk to them. Typing it in now so you can have them call me.
Thank you, Monica. From, oh, go ahead. Do you want to go? You can go ahead, Samantha.
I was just going to say thank you to Lori for, I don't really have a question, but I wanted to say thank you in all caps for organizing this program. It was terrific. I got my vaccine first and second shots at Stephen Klein Wellness Center, and it was so great to see so many people there getting the vaccine and other medical services. Yes, I think we all as staff and residents felt exceptionally blessed and honored to be vaccinated and make our community safer. Really have to major kudos and not enough acknowledgments to Monica and Ivel for, making sure that our community is staying safe and staying up to date, and making sure that we are aware and how to be safe and, make sure that we are doing what we can to protect our community.
Absolutely. Any other questions from the group? Don't be shy.
Lots of thank yous. Lots of really great engagement from everybody out there. Thank you so much for being part of this. Another question? Don't want to skip over anybody. Is there one, Melanie?
Norma just wants to acknowledge that she's so impressed that all our team does. Thank you very much, Norma.
Thank you, Norma. We're so grateful for all that you do, and each one of you. Thank you so much for being part of this tonight. Please do reach out if you have any additional questions, anything else that we can answer. We have another one of these coming up in the series, and it will be on June the 8th at 5:30 at home with Sister Mary Scullion. It'll be fun. And the title of that talk is just, where are we now? There's a lot going on, as you all know, there always is. And Sister Mary will be joining us to fill us all in and take lots of questions. So thank you all so much.
Oh, and
Oh yeah.
sorry to interrupt. We did just get another question.
Oh, go ahead. Go ahead.
Sorry. This question is probably also for Monica. This person says, forgive me if I missed this, but what is the protocol if someone in the Project Home community doesn't want to get the vaccine?
Yeah, I've also put it in the chat too. Thanks for your question. So at Project Home, our policy for the vaccine is to not make it mandatory. It's totally voluntary. So we just try to share the data and the information and try to make it as accessible as possible, but it's totally voluntary.
Thank you, Monica. And sorry again to cut you off on that.
No, not at all. Thank you so much. Thank you again, everyone. Stay safe. Anyone, I believe, can schedule a vaccine at the Stephen Klein Wellness Center. Is that right, Monica?
That is right.
Haven't been vaccinated.
Yes, I'll also put that in the chat now too, so you know the number to call. Yeah.
So thank you all again. Be safe.
Ashley,
Stay well.
Annette,
Yes,
can I make a comment if I can, please?
sure.
In 2018, I had no hope whatsoever that I was going to have my own apartment, that I'd have to be living in Kate's place. And I would be the first one to sit here and tell you that it's horrible feeling what you feel. But with work and determination and advocating for yourself, no one is going to get you where you want to be except you, the individual. Don't depend on other people to do something for you that you have to try yourself. If you try and you can't do it, then you at least say you can try, and then you go get help. But I cannot stress enough, do this, get out, do the walking, do the talking, whatever you got to do, get contacts, whatever you have to do. I am living proof, as Linda Costello, that you can come out of this, and you will. Thank you so much.
Thank you, Linda. Thank you. Touched my heart. Thank you, Linda. That's encouraging. We appreciate you. Yay. All right. Thank you all, everyone. Be well. We'll see you on the 8th of June.